Good evening and welcome to the joint meeting of the school committee and the Board of Health for the town of Winthrop. The date is Tuesday, November 17th, 2020. This meeting is being held by way of a Zoom teleconference and may be televised. Ms. Galvin, could you call the roll, please?
Ms. Barry?
Here.
Mr. Boncory?
Here.
Mr. Capabianco?
Here.
Mr. Martucci?
Yep.
Ms. Swope?
Here.
Ms. Powell?
Here.
Mr. Perrin?
Here. Okay, Mr. Boncory, could you lead us in the Pledge of Allegiance with your flag?
Oh, sure. I pledge allegiance to the flag of the United States of America and to the republic which it stands one nation under God, indivisible, with liberty and justice for all.
Thank you, Mr. Boncory. Okay, under general functions, Board of Health review of the current COVID-19 public health status, review and discussion related to the school health and safety measures in response to COVID-19 protocol that can be implemented. Ms. Howard, could you bring us through that, please?
Sure. I see that Astrid Wines is on, and Astrid, I don't know if the other members, I see Susan is on. Is Bill on? Oh, I'm talking.
I spoke to him. He said he was coming on.
He'll be calling in.
Okay. So we have, the school committee has asked to hear from the Board of Health to get some information from them related to the current health of our community. And also, now that you've had the opportunity to review the plans that the school has in place already regarding our health and safety of our students and staff, we just were seeking some feedback from the Board of Health as to, you know, sort of the situation in our community, how that relates to what you have had the opportunity to read about our plans moving forward, including, most importantly, the school committee's vote to launch our hybrid learning plan, as well as our fully remote plan for our families, effective December 7th as of now. So we were seeking feedback from you just regarding those those two items. So I'm going to turn it over to the Board of Health to begin to let us know some thoughts that they have.
Thank you.
Is Bill here yet, or should I start?
Yeah,
Oh,
hi.
he's here. Okay, good.
Let's see.
We had a problem with my phone, so I apologize. So I missed the last couple of meetings, so is it our turn to
Yeah.
speak?
Yes.
So hi, this is Bill Schmidt, the chair of the Board of Health, and I appreciate that the school committee has invited us to participate in this discussion. As you probably know, the Board of Health is in a position to offer guidance to the school committee and the superintendent on their reopening plans. The ultimate decision on the opening of the school and the timing is clearly the jurisdiction of the superintendent and the school committee. Astrid has prepared some slides that she wished to offer for consideration, so I'll turn it over to her at this point.
Thank
Okay.
you.
Astrid.
You need to enable the screen sharing for me.
Yeah, I'm gonna make you co-host. Okay,
This
You
during the presentation.
should be able to now, Astrid.
Yep. Okay. Okay. So just to reiterate what our role here is not to make a decision on whether we should open the schools in Winthrop or not. It's really just to merely provide some input from our perspective. After all, it's a decision that has to be made based on a lot of different factors, and we're really just providing some enlightenment on one of them, which is the public health of our community. So first of all, I just want to go over a few things here. regarding the COVID risk for school-age children. So what is known in the scientific community is that children are less likely to transmit and to contract the virus than adults. And that is true for preschoolers most of all. They're less likely to transmit and contract than elementary schools, and those are less likely to transmit and contract than high school kids. High school kids are really very similar to college age adults. So they have a higher likelihood to both transmit and contract than younger children. All children can be infected and spread the virus to others, that is known. Infection occurs more often in teenagers than among younger children, and older children appear to be more susceptible to infection and to transmit more often than younger children. So that's just one important point to keep in mind here. There is a very strong link between the number of outbreaks in schools and local community transmission, meaning if you have low rates of transmission in the community, you have a very low risk at schools, and that doesn't really change your risk much if the school is open or closed. And if you have high community transmission, then obviously the school is not a microcosm and reflects what is happening in the community is also reflected in the school. Schools being open in the past and in the last few months has not led to a rise in community spread overall when community infection was low. And that's a very important point, very important determinant. Community infection low, schools don't pose any additional risk or enhanced risk to the community. When community infection is high, it's reflected in the school transmission as well. Preventative measures, prompt case detection and contact tracing averted larger outbreaks for the most part. So those are very important measures that we and others need to take who wish to open schools. And then there were some large outbreaks that have received a lot of attention in the media. One was in Israel with 178 cases, 153 students, 12 to 18 years of age, and 25 staff members in a high school. That school was extremely crowded. They had few measures in place. They didn't have a mask mandate in school. So it's very important to just keep in mind that the big outbreaks that have been in the media, including also the one in the overnight camp in Georgia that affected 260 cases, they had very few preventative measures, mitigation measures in place. So that's not really a comparison to what's happening in Massachusetts in any school here. When there is widespread community transmission of SARS-CoV-2 or the number of cases is rising, it's obviously much more important to have protective measures in schools than when you don't have high community transmission. So let me go to the next slide. So again, there were very few outbreaks reported in schools since early 2020, and most infections or COVID-19 cases reported in children, infection was acquired at home, not at the school. More outbreaks were reported in secondary and high schools than in primary and elementary schools. This reflects the notion that children of less than 10 years of age are less susceptible and less infectious than older children. And in school outbreaks, it was more likely that the virus was introduced by an adult, mostly the personnel, than by a child. So that's another very important factor to consider. Overall transmission from staff to staff was much higher than between staff and students, either way, and that also was much higher than student to student. So another thing that's important to know. And then the modeling studies that we have from the first few months of COVID suggest that closing schools reduced community transmission less than any other social distancing intervention. So the schools have, the closing of schools had very little effect on the overall rate of community transmission, much less of an effect than any other measures that were taken. I just wanted to go over this study real quick because this has received a lot of attention. It was also in the media, and this is just recently published as in the Journal of Pediatrics, which is a very highly regarded journal, high impact journal in the medical world. And it's about COVID-19 transmission in US childcare programs. So they looked mostly at how much the staff in childcare programs were affected by COVID-19. So they didn't really look at the kids, they looked at the caregivers, okay? And so I'm just, I have all of you here in the way, so I'm gonna have to move you away. Overall, we found no evidence, and this is a direct quote from this paper, we found no evidence of childcare being a significant contributor to COVID-19 transmission to adults. This finding is consistent with previous studies showing a lack of association between school closures and transmission rate. And this, again, is transmission from adult to adult and from child to adult, not the other way around. The caveats of the study is the study focused only on children to adults and adults to adult transmission, and it only really looked at settings providing care to children, and most of those children were less than 6 years of age. So just really more of a preschool focused study and not so much, you know, any kind of high school or even elementary school age children. Adults overall are more likely to transmit to children anyway than children to adults. So that's why there's a skewing towards this kind of transmission route. Children represent overall much lower percentage of COVID infections. And then what it really they say too in the paper, and this is also a quote, that spread from childcare workers to children may still lead to children's family members, including those most vulnerable to the virus, contracting COVID-19 from their children or grandchildren. So kids that might bring this home from school because they got it from a caregiver might give it to their vulnerable adults in the household. What they say very clearly at the end of this discussion in that paper is that if they adjusted, after they adjusted for all these variables, all other variables, community level transmission remained a significant predictor of childcare providers testing positive or being hospitalized for COVID-19, highlighting the importance of reopening childcare programs only when background transmission rates are low and decreasing. So they use the World Health Organization threshold of less than 5% positivity for at least 14 days as a good measure for when you should open schools or childcare programs and when you should not. And then it also said that although the study provides evidence that childcare may pose negligible threat to community transmission, communities may pose a considerable threat to childcare. So it really is important to see it that way, that the childcare facilities don't pose a threat to the community. It's the other way around. The community poses a threat to the childcare facilities when you have these high background transmission rates. So conversely, when you have low rates and they're well managed, these, you know, these infection mitigation efforts are in place, you know, these things, these transmissions are really, really rare. So let's look at the US overall. There is this page called US COVID-19 School Dashboard, which is a crowdsourced site that is available. If you Google that, you can look at it and you can, you know, search for all kinds of different parameters. Those are schools that are reporting to the system. It's not a mandated reporting, but I think about 9,000 schools or so report to this from all over the US. And what's important here when you plug in, you know, just overall everything hybrid and full in-person schools, that overall staff seems to be at higher risk than students, which is kind of probably a function of the fact that adults are just generally more affected than children. And students and staff rates totally mirror more or less community case rates. So it really is very noticeable that when the community rates are lower, rates in schools are lower and vice versa. So it really has a direct impact what your community rates are on the school rates. And then there's this paper that was in the Boston Globe, this report that was in the Boston Globe just a couple of days ago, where they have this map of reported COVID cases at schools. You can see here that, you know, and this is a community up north. This is Haverhill, actually, and this is Fall River down here, and that's Boston. The little black dot here is actually Winthrop. We obviously have very low cases because we don't really have anyone at school right now. But in communities like Haverhill here, which has a little bit lower transmission rates than Winthrop, in fact, right now, they have significant spread at their school. They had a kind of an outbreak happening there. So it does happen, but it's very rare. And overall, you can see the rates of transmission in Massachusetts at schools are very, very low. And what we don't know is if these kids got the virus at school or if it just overall happened due to some outbreaks in the community. What metrics are we using for community risk designation right now? And this is the new metrics that just came out about a week and a half ago by the governor. Winthrop falls into the population here from 10 to 50,000 residents. And here the metric is used for yellow. You have to have, you can have greater than 10 average cases per 100,000 inhabitants, or a greater than 5% positive rate. That's kind of where we're at right now. And we have 62.1 per 100,000 is our current rate as of last week. On Thursday, we get the next report, then we'll know. And we have a 4.85% positivity rate in Winthrop. So we fall right into this like high yellow cohort. What's noticeable here is that we are about double the incidence rate of other yellow communities in that cohort. So we're the highest actually in that yellow cohort in terms of the cases, and we're about the third or fourth in terms of the positivity rate in that yellow cohort. So we're kind of like getting up there, but we'll have to see if we go to red this week, or if we stay in that yellow cohort here. Then just to look at our daily incidents over the last few months. So if you look here from the beginning of the pandemic, we had that first peak that was in April and beginning of May. And then we were kind of on the low side for a long time. And then just recently last month, about a month ago, we started having these outbreaks. And here's our peak right now. So we are basically now at 62.1. And if you look at when you last voted, and correct me if that's wrong, I think that was on sometime in like mid-August when you last voted for, I think, remote back then, that was here, and now we're here. So obviously we have a much higher daily incidence rate right now than we had back then. Just for your information, this has I'm not making any judgment here. I'm just really telling you the facts where we're at right now. In terms of the positive test rate, that's been fluctuating a little bit. This is around the time of your last vote here. We were around 3.5%, and now we dipped down a little bit, and now we're back up at 4.85%. And the trend is going up right now. And we are considerably higher than Suffolk County as a whole at 1.71%. And then when you look at Massachusetts metrics, the positive test rate has been going up, unfortunately, pretty significantly. This is, again, where we were back in June, pretty high, and then it went down, and now it's going back up. And if you actually correct for the Massachusetts higher education testing, for which they're doing a lot at colleges right now, if you take that out of the equation, our positive test rate is actually quite high at 5.25% in the Commonwealth. So we're seeing an uptick in cases in terms of the positive test rate, but that alone, you could say, well, people argue about, well, who's getting tested, how many times are people getting tested, all these things. But I'm showing you this graph, which is, I think, much more compelling to me, because this shows you what's in our wastewater. This is actually MWRA data on how much virus RNA signal there is in our wastewater. So we basically excrete virus, when we go to the bathroom. And this is essentially what we had. This was the peak back in April, where we had a lot of virus in our wastewater, and then we had almost nothing. And now we're getting up there again. And this really directly reflects how much virus load there is in our communities in Massachusetts. And this is just northern Massachusetts, which includes Boston and also Winthrop. So I'm just telling you this to show you that there is actually pretty objective data that is not reflective of just the testing and who's getting tested, but really shows you that we are seeing an uptick in viral load in our communities. And my projection and the projection of a lot of public health experts, and I'm not a public health expert, but I am on the Board of Health and I'm a physician, is that I think we will see an increase of this activity due to we will be in colder weather very soon. People are spending more time inside. There are going to be major holiday gatherings happening. We have Thanksgiving coming up. We have Christmas coming up. And then also we have college students that are going to be returning from out of state soon. So I believe all these things are going to add to our caseload. That doesn't mean that as a community we're going to do worse, but I think as a whole in Massachusetts, we're going to do much worse in the next month or two. Again, the modes of transmission of SARS-CoV-2, something that is very important to keep in mind. There are 3 major modes of transmission. There's also other things that you should keep in mind that they could, bind to surfaces and things like that. But that's really negligible when you compare them to these. There's the contact mode, which is direct contact with infected people and their secretions. And then you have the droplet mode of transmission, which is through saliva and respiratory secretions, through sneezing, coughing, singing, all of that. And then there's also this, which is the airborne transmission or the aerosol transmission, which happens through exhaled air. And then you would end up with aerosolized, really, really tiny particles in areas with poor ventilation that can travel quite far. And how do you mitigate for these things? For contact and droplet transmission, you obviously mitigate that with physical distancing. You get away from people. You don't inhale these, clouds of virus particles that are coming directly from these individuals, and you practice proper hand hygiene. And droplet and airborne transmissions you mitigate with wearing a mask and using ventilation. And all these things are really important in mitigating COVID-19 transmission in schools. So again, school outbreaks, but really any outbreak in an indoor space are associated with increased community transmission, insufficient physical distancing, poor ventilation, and lack of masking. And that's been shown and that's been demonstrated in many, many studies that these are the main things that are contributing to these outbreaks. So what mitigation strategies do we have in place for schools? And I just want to briefly go over these, and then Lisa can talk about it in more detail, but these are the main things that we should keep in mind. The first important mitigation strategy is to minimize the import of COVID-19 infections into schools. And that's really a community-based effort. That is us, all of us. That is not the school, that is not the state, that is us as a community. We have to, anytime we are symptomatic, seek diagnostic testing, okay? We also need to recognize that 15 to 50% of children and 10 to 30% of adults may be asymptomatic or infectious while they're pre-symptomatic, meaning before they become symptomatic, they're already infectious. So this is really something, and that's kind of the wild card in this whole thing, right? We don't have school-wide testing-based surveillance available right now. It's just not feasible yet. We don't have the infrastructure for it. We don't have enough testing yet, and we don't have enough availability of personnel to do this. So it's not fast enough. So this is not available, and this is really where the biggest wild card is in this whole opening of schools, that we don't know these asymptomatic individuals. And then what becomes really important is the daily symptom screening and attestation by all parents and also the staff, that they have to fill out a survey every day saying our child doesn't have, any symptoms, yada, 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 has not been in contact with anyone who had COVID, and also doesn't have, has not tested positive for it. And then the most effective tool obviously would be to restrict in-person learning to when community infection is controlled. So there are a lot of different standards. Some people say you have to have less than 10, less than 30, whatever. There are different standards in different countries and even different states of new infections per 100,000 per day. or a less than 5% positivity rate over a prolonged period. These are the most common criteria that people are using to determine when in-person learning is safe and when it's maybe less safe. And then the second mitigation strategy would be to minimize the likelihood of transmission at school. So that's the school effort. That's where the safety plans, the exposure control plans, all of these things come into play. That's where we have to make sure the kids are, and also the staff are physically distancing, that they have they limit room occupancy, so we don't fill the school with students. We actually reduce how many students are attending at any given time. We really want to practice crowd control at all sites, including drop off, pick up, in hallways and bathrooms, things like that. We want to limit duration of potential exposure. So that means the mask breaks, which they are usually built in schools, should be limited to 5-10 minutes, something like that. The lunch breaks should be really limited to the whatever time that is necessary to eat your lunch, and then the mask should go back on. Surfaces have to be disinfected, although that's probably the least important of all the measures, because people should not be really sharing spaces to a degree where they use the same surface. Ventilation, very important. We have, and I had that question for Superintendent Howard several months ago. How is our status momentarily with the ventilation systems in the schools? We have significant upgrades that were made this summer in all the schools to the ventilation system and the filter size. MERV 13 is the lowest filter size that is really filtering out significant aerosolized viral particles, and that is available in all the schools, and most of the schools actually have higher filter systems even available, the highest ones that are available for the systems that are built into the schools. So that's very good in Winthrop. Hand hygiene is important. Masking, obviously, I don't have to say that again. Masking is key. And then also limiting your indoor activities and doing as much outdoors as you possibly can. Obviously, that will be hard in the winter time, but it might still be possible to some degrees to move some of the schooling outdoors. And then the third mitigation strategy would be avoid outbreaks at school. How do you limit secondary transmission to the smallest number of persons possible? So if you have an outbreak, how do you limit it to make sure that not too many people are affected? And that's really done by the school and they will make sure we have small cohorts in classes, 10, 12 students, not more. That these students are also early, that are detected in an early fashion if they are symptomatic also at school and are immediately isolated if something comes up. That we perform early and fast diagnostic testing when these students do show up with symptoms. And that's really our health department. Here's a picture of Meredith, and also the contact tracers that are calling from the state. That is a very important thing, that people are responding to those calls and giving information. So these are really the factors that avoid and limit outbreaks should that happen. So that's another very important factor. So overall, just to kind of summarize what I said, those are the take-home messages from the Board of Health. COVID-19 appears to have less effect on children than on adults, and that's a fact. So the children are probably relatively safe. Adults, teachers should be, viewed with a little bit of more caution. I think they're right to be a little bit more scared than maybe some parents are. Children in schools are unlikely to be main drivers of COVID-19 transmission when community transmission is low. And that's really the most important take-home factor, that the community transmission should be as low as possible. And that's what we all can contribute to a successful school opening without any incidents. We will see positive cases because community transmission is mirrored in school rates, school COVID rates among students and among staff. But then we need to make sure that appropriate mitigation measures are applied. I think that it's fair to say that more caution is necessary regarding high school, secondary schools, and older students compared to young primary and elementary school students in terms of their likelihood of developing severe disease and contracting and transmitting the virus. And then adult personnel is really at the highest risk of acquiring and transmitting the infection. And that's just because adults are more likely to get sicker. Adults have usually more contributing factors, predisposing factors, and also, as we know now, probably have more receptors for the virus in their nasal mucosa. And that's why they might be more susceptible to actually acquiring the infection. So control measures are very important to protect the staff. And then we need to make sure that isolation and quarantine measures are built into the safety plan for the school. Community transmission has to be factored into the decision for making for against reopening. And I think that's my most important take home point. Adherence to public health measures in the community is absolutely critical to protect the schools from amplifying transmission. They will only amplify it if we have high numbers. If we have low numbers, there's nothing that we should be scared about. So we really need to make sure we get our numbers down, first of all, again, and keep them down. So the community effort will be extremely critical here. And then last but not least, I think what we need to make sure is that our health department is not overwhelmed. And they're already at a breaking point right now with a lot of cases that they have to contact, trace, and call and make sure and follow. So the viability of our health department is absolutely critical for an effective outbreak prevention and control. So really, this is my most important take-home point, really, is the last one, that we need to make sure we protect our health department and support our health department. And the main support that we can give them is to keep community numbers low as possible. And that's really all that I have today. Thank you.
Thanks.
Thank you, Astrid. I know you guys have another meeting to go to, Phil, but is there going to be any time for either a member of the school committee or myself just to have a quick follow-up question or point?
Absolutely. We can have a discussion. We can postpone our meeting a little bit.
Yeah, so I would say, and Susan, first of all, let Susan McGuire, maybe you have some comments you want to add from the board's perspective.
Here I am. Okay. That's, I don't know how anyone can follow up Astrid's presentation. Thank you, Astrid. If anything, I think it's more than convincing. I think that we revisit establishing timelines for reopening. I guess quickly, my recommendation that is to watch the data and revisit in mid-December. I think we'll have 3 more weeks of trend data. My other recommendation is, how can we increase our mitigation on a community level? I know we've had this discussion before, but I think we need to continue to do that. And my last point, I think we probably know New York's benchmark or their threshold for reopening schools is a 3% positivity rate. So I can't thank you enough, Astrid. Great job. And Lisa, thank you for inviting us.
Thank you for coming.
Yeah, let me just make one other comment, because we are going to try to get to our other meeting not too late. But I think it's a very difficult choice you have before you, because obviously there's a lot of, everybody wants the students back in school. The question is, what's the correct timing? And I think, just from my own personal perspective, given the holidays, given the fact that, given the data that we just showed there at 4.85, it's very possible that we'll be in the red again in the next week or two. And so the question you might have is one of timing, and whether or not starting in December between the 2 holidays is a good choice.
Also my recommendation would be to wait until January, just because my opinion is always the devil you know is better than the devil you don't know. And I think we don't know exactly where we're headed right now. We're kind of flying blind. We know the numbers are going up, but we don't know where our community is going to be. And I think the next couple of weeks will be very important to see what's happening with Thanksgiving and where we're going to end up. I think overall it's possible to open schools in a safe way. I personally am not a complete, antagonist to opening schools. My own child is in a school right now. But I think that it has to be done with the utmost care, and the community has to be completely behind it.
So,
Brian?
Lloyd.
Yeah, I just want to thank the Board of Health for joining with us, and I want to thank Astrid for her presentation, and Bill and Susan McGuire, who unfortunately is going to be leaving the Board of Health, and sent me a letter of resignation. I wanted to take this opportunity to thank her for her service publicly for the many years that she's put into the Board of Health. You're going to be hard shoes to fill, Susan.
Oh, well, thank you very much, President Corey. Thank you.
Thank you, Susan, for all your hard work.
Thank you.
well, thank you all. Thank you all. We're going to try. We're already 10 minutes late to our meeting, so we'll leave the discussion to you folks. And as Lisa stated, feel free to reach out to any one of us on any of these questions.
Chairman Schmidt, can we just have one question from Mr. Capabianco, please?
Sure.
Thank you, Astrid. Thank you, Susan. Thank you, Mr. Schmidt, for that presentation. Look, my personal opinion is it's unsafe to go back. However, we're in the yellow right now, and our job isn't to give personal opinions. It's to follow the guidelines to the best of our ability. And I know other communities have given, boards of health have given official recommendations. I know that happened a few weeks ago in Milton. So we appreciate your opinions, but if we were going to follow the guidelines, the Board of Health needs to offer an official position, not a personal position.
I think our official position is pretty clear. We all agree that you guys should wait until after the holidays. That is our official stance, and we can vote on that on our next meeting if that's something that we should do.
Well, our meeting which is following at 6:30, which is now about 10 minutes late, Mr. Capabianco, I will bring this before the board, and we may very well take a vote at the meeting, and if we do, we'll share that with you.
Well, then how could we vote on it before you guys if we want to follow the DESI guidelines, if we're taking collaboration? That doesn't make any sense.
I'll let you folks decide that question. All right. Thank you very much.
Thank you very much. Much appreciated. Thank you.
Bye-bye.
Yeah. Wish you well. Good luck.
Thank you. Doctor, thank you for your presentation.
Thank you.
Unfortunately, we didn't have a little more time to discuss. But Ms. Howard, you want to bring us to the return to school format of?
Sure. If I can have people just mute in the background so that we don't have background noise as we move forward. It's a little bit difficult to hear. So making sure I am not on mute, which I am not. I'd like to start with just a little bit of information to help inform the community. We have a lot of listeners on. I'm sure we have a lot of people watching. So I've received several emails, as had the Board of Health has received, the school committee has received. It's my understanding that the town council has received. And today, lots of emails to clarify points from community members who are receiving information from multiple sources. Of course, that is included but not limited to social media. So I think it's important for me as the leader of the school district just to have some points of clarity for the community, as well as those listening. This is a lot of information that the school committee already does know. And so to start, I think it's important for folks to understand that from our perspective here within the school district, that the teachers union is not proposing a strike, nor has there been any discussion for any type of a movement or a protest by the Winthrop Teachers Association. I also wanted to make clear that there has been zero indication that the staff of the Winthrop Public Schools is refusing to come to work on December 7th, which is the date that the school committee has initially voted for us to move to hybrid. We have a fully executed union agreement, a memorandum of understanding regarding how we will be working during COVID. That memorandum of understanding was worked on for several months with our teachers union collaboratively, and that's fully executed and in place. Our staff, we have staff that has the right to and is exercising their rights to either family medical leave or for accommodations under the Family Medical Leave Act. This is not new. This has existed pre-COVID for many years. And it's not specific to public schools. It's for all employers. There is family medical leave and ADA accommodations. We currently have 16 staff members who are exercising their right to either FFCRA, which is for families who are struggling during COVID to find childcare, ADA, or FMLA. We can reasonably predict based on that number, that's a known because it's happening right now. We can reasonably predict the staff that may need those accommodations moving forward, whether it's for medical reasons. We have folks that are going to be going out on pregnancy leave, maternity leave. So we use that information to reasonably predict our staffing as we move forward. Replacing teachers, just as another point of information, during a pandemic has not been easy, and the applicant pool has been very low. However, we continue to move forward and find creative ways to recruit staff. Hiring non-certified teachers to teach our students may seem okay to some, but quite frankly, from an educated perspective, it is not okay by the Winthrop Public Schools. The most recent communication to our parents in which we had them commit to a model was not a survey. It was a commitment so that we could continue with our planning and get our students back to school as soon as possible. The information about the hybrid model and the fully remote model that was presented to parents when they were asked to commit to either a model of full in-person, a model of in-person learning or full remote learning was done for the sole purpose of helping us figure our staffing out and make sure we had enough staff in place when we return our students safely. The few more points. I received some information today that folks feel that there is of that commitment that we asked parents to make, that 60% of our parents committed to keep their students home. That is factually incorrect. I have not shared that data that we have collected from our families with the school committee as of yet, and certainly have not shared that out to the community. So the fact that people think that 60% of our families chose the full remote model is simply not true. The closure of schools in March was not the choice of the Winthrop Public Schools, nor was it driven by the union. In fact, it was an order by the governor. So I received some information today that folks think that we chose to close schools back in March. And again, that is simply not factual. The opening of Winthrop Public Schools for in-person learning is also not the choice of the school committee or the teachers union. And again, that's an order from the governor and from the Department of Education. Offering remote learning for students is not the choice of the school committee or the union. That's required by the Department of Education to allow parents a choice if they feel that when we are going back, that they are not ready to send their children back. What is the decision of the school committee is when to open school for in-person learning in a manner that is safe and with the best possibility to remain open. Making this decision without looking at the data to inform how they will finally decide would be irresponsible if they didn't look at all of that data. It is being looked at, data that's being looked at is, as you heard this afternoon, the COVID health status of our community, which was provided to us by the Board of Health. We're also looking at staffing to ensure that when we do have our students within the building, that it is safe and that we can be in the classrooms with them, even if some of our staff cannot be. And another important bit of information that seems to be out there in not factual is regarding all the other guidelines and recommendations, actually, but mostly guidelines of the Department of Ed and the CDC. The state of emergency has not been lifted, and therefore neither has the large amount of health and safety requirements that we must have in place when we do open our schools. And that includes things like PPE, distancing, mask wearing, and making sure we're able to feed our students in a safe manner. And I think Astrid had touched upon many of those points. The reason I provide you with this information is we have flooded families with lots of information, and it is very difficult to keep track of, and I totally understand that. My concern is that the information that is out there is not coming from the schools, and I would encourage folks, if they have a question about whether or not something might be factual or not, that they reach out to a principal, a school committee member, or myself to ask those very questions, because making assumptions can lead to a lot of fear and concern around our school system. And so, Mr. Perrin, that was the major point that I wanted to bring up tonight, just to make sure as you are making your decisions and as families continue to make decisions, that they have factual data to reflect on and not necessarily just the assumptions of many. You're on mute.
Go on mute, so I went on mute.
All right.
That's all right. Does anyone have any questions for Ms. Howard relative to her position, or has anything changed since our consultation with the Board of Health? Ms. Swope.
Thank you, Mr. Chairman. I just wanted to ask Lisa exactly, I want to make sure what our vote on the school committee would mean. In other words, you're saying that the state decides, first of all, whether schools can return. And then the school committee decides when they can return on the basis of what the governor and DESE has to say. Is that my understanding of what you just said?
Sort of, yeah. So it is a given, just like when the governor closed schools back in March and made the statement that schools will be closed, that we had no opportunity to say we're not going to do that. We had to do that because the governor had made that decision. The governor came out about 2 weeks ago and informed us of the metric change, which I believe, many people were excited that the metric was changing. I think lots of folks felt that that was a very conservative metric in the beginning, but there had to be a metric in the beginning. And I think that the state has taken the time necessary to figure out some changes that needed to be made. And again, making a data-driven decision to change the metric takes time, and you have to start somewhere. And so they did make that change. And when they made that change, coupled with that change, the governor came out and made a statement that with the change, he expects that schools will have in-person learning moving forward. And I think I couldn't imagine a person who wouldn't be excited about that. So we have two choices in terms of learning in school districts, one of which is how and when we go back to school. However, we don't have a choice in the fact that we will provide in-person learning. We also don't have a choice in the fact that not only will we provide in-person learning for our students, but we will also give parents a choice to keep their students home fully remote if that is what they so choose to do. What we don't have a choice is just to say no, that we're not going to return our students to school. That is a given. Students will be coming back to school, and we will be giving parents the choice to continue with remote learning. So hopefully that kind of clarifies it.
That follow up. But having said that, for parents who decide to keep their children at home, they may have no choice for synchronous learning. They could be in a position for only asynchronous learning. Is that correct?
So as we determine how our staff looks, our goal is and always has been to provide as much synchronous learning as possible. What is synchronous learning? That means somebody actually teaching children either live or with recorded lessons. However, live is the direction that we want to go.
Right.
When we present the hybrid model that we developed, which was accepted by the Department of Education, we have changed that model a number of times based on experience and what we know and what we can provide. As we now have had our parents commit to either hybrid learning, the hybrid learning model or the full remote model, we now are able to understand what those two groups of students and families will look like, and we're continuing to review that information. And as we figure that out, we're able to determine how much live instruction or asynchronous and synchronous instruction we can provide. Our goal is not to be asynchronous 100% of the time for those students who are in remote.
Yeah.
But we can't tell parents how much it will be until we know what our staffing looks like and how we can group our students with the understanding that the goal is to provide as much direct teaching, live teaching, synchronous teaching as possible at every grade level.
And if we go back into code red, what does that mean? Or
So
coming back to,
yeah, so prior to the governor's releasing his most recent information, the Department of Education also released information about once you transition to a hybrid model or when you are in-person learning, which is the same thing, if your community then goes red, just like we have to do when we turn yellow, you have to watch that data for no less than 3 weeks to ensure your stability. If in fact, this is the change from what would happen in red probably a month ago to what happens in red moving forward. If you are already in-person learning and your school district turns red, prior to the change, you could wait the 3 weeks and then return to fully remote. Now what they're asking you to do is not to do that just based on the community turning red, but to look at additional information as to how school spread is happening. And if there is not significant school spread, even if your community turns red while you're in-person learning, the school district can and should seriously consider staying in school during that time. The whole idea behind that is not to sort of be the yo-yo of back and forth, in-person, out of person, in-person, out of person learning for students, if that makes sense. It
sure.
makes sense in my head because I say it all the time, but
Thank you.
it may not to everybody.
Thank you.
Does anybody else have any matters for discussion with the superintendent as to the timeline? I'm a little confused that we didn't get an official vote. I thank you, Mr. Capabianco, for raising that. It would have been nice to have an official vote, but we did get some guidance. And if I'm summarizing this incorrectly, someone please stop me. But we were told that it would be best to push out the timeline to the middle of January. And I know that's something that none of us wants to do, but this is what I heard. I don't know. There are no right answers. It's very frustrating for all of us.
Can I ask a question?
When I'm done speaking, please, if you don't mind. So
I'm sorry. No, my Wi-Fi keeps cutting out.
that's okay. I'm just in the middle of a thought. But from what I'm hearing from Dr. Astrid, excuse me, Dr. Wines, she's saying that the community levels directly correlate with the number of cases that occur in the school district. And they're asking, due to the a number of factors. We're not asking, but her opinion was that we're going to see a large spike in the schools coming, more than likely coming from returning college students, family gatherings and holidays. I have legitimate concerns about that based upon what was said. So I just want to raise that if anyone would like to discuss it. Mr. Capabianco.
Thank you, Mr. Chairman. And like I said earlier, boards of health and other communities have taken formal votes. I deeply appreciate everything they said, and I agree with them. I just don't think we're in the business of forecasting what's going to happen. We have to look at the guidelines by the book and call balls and strikes here. Now, correct me if I'm wrong, but I think at the end they said they might take a formal vote after this meeting. I don't know why their meeting was scheduled after our meeting. It's truly, we kind of had to work together on this. So I don't think there should be a vote taken tonight. We should see what they formally do.
I have not heard anyone make a motion yet, but I would like to hear from Meredith Hurley, our public health nurse.
Hi, everybody. Can you hear me okay? I think my Wi-Fi sometimes is spotty too, so hopefully not tonight. So our current case count, 715 total cases. We are seeing a decrease in our isolated cases. It's always interesting to report the numbers on a Tuesday just because Sunday our testing site is closed. So historically I get very few cases reported on Monday. And then they tend to come in later in the day on Tuesday. So I think what we reported out this afternoon or this evening were 3 additional new cases, but the testing from yesterday is starting to come in. So, so we have 60. I'm still anticipating that we will have a very high incidence rate this week. I don't think that we'll be in the 60s.
7 o'clock.
In the 60s like we were last week. It's really difficult. I have no way to calculate the percent positive. That's completely dependent on the state, whereas before I've been able to extrapolate out a sense of what our incidence rate is going to be. I can't really do that with the percent positive, and since that is what is keeping us yellow right now, that I wish I was able to share that information with you guys right now. I believe our percent positive will be someplace our incidence rate will probably be someplace in the 40s. But trending down. But I think we're all getting stuck on this percent positive metric.
Thank you. Does anyone have any questions for Meredith Hurley?
Meredith, do you have a recommendation? You're not giving. It's not. I know it's not your job, right? That's above your pay grade.
I think it's a very difficult position for all of us to be in. What I can share is, is that the percent positive, as I'm not 100% sold on the percent positive being given the weight that it's being in decision making. And my basis for that is that it's a calculation that's based on the amount of people who go and get tested. It is not necessarily everybody in our community. So it's a way in the science world and in the data world where bias can somewhat be introduced, and it's not bias that we know about, but it can be a bias in some capacity. So I've always been a little hesitant to put all of our eggs in the basket of the percent positive. I think it's a good metric to show how many people are getting tested, which we know we're testing a lot here in this town, and our capacity is amazing. We're moving down a trailer to the site as of Monday with heat for staff, considering if there's going to be an extension past the December 31st date. So, I'm thrilled to see the amount of testing that we're doing here. But I do have I think I have to do some more research on what exactly the weight that this is being given in these decisions.
Thank you, Meredith. Ms. Barry, you had your hand up?
Yes, I don't know if it's a question or more of a statement. I go because, hearing from the Board of Health and from Meredith, we're looking at, one part of the story. It doesn't tell the whole story of what's happening in our community with children being out of school. It tells us who's getting COVID and what our case rate is, but it doesn't speak to what's happening in the lives of students today. And I think that's a really important thing that as a community, we should also measure. So let's not just measure the positivity rate and percent of, or the number of people that are contracting COVID. Let's measure how many children aren't showing up for school. What's the measure of inequity? How many children are suffering from mental health issues? How many children are paying that never had to before? Who's paying for tutors? We're looking at one part of the story, and while I think it's obviously very important, I think we're missing, it's very quantitative. We're missing another quantitative study, which is how this is truly impacting the students at home. And nobody seems to be measuring that. I don't mean that as a knock on anybody or anything that anyone is doing, but we're not telling the full story here. We're not looking at the full picture. I'm also very concerned that, pushing off an opening date till January means, okay, let's go back January 4th. Let's go back January 19th. Oh, wait, we have February vacation coming up. Maybe we should go back March 1st. I mean, there's never going to be a good time. That's the thing. We're in a pandemic. It just, to me, is how long are we going to wait? Sorry, that wasn't necessarily a question. I just, needed to get that off my chest because I don't think we're looking at the full picture.
Ms. Powell, you're on mute.
Unmute yourself, Jen.
Meredith, on the positivity rates, if we have more people who are testing who are not positive, wouldn't that make our rates go down? Or positivity rates go down?
Yeah, so the way I understand it, the state calculates, so there's a way to calculate percent positive where they look at purely just the volume of cases. So if there's 10,000 people that are tested, or to make it easier, say there are 100 people that are tested and 20 of them test multiple times, those folks would be counted 20. Like if one person gets tested in a 2-week period 14 times, here the number that they give us, I believe, is that that number, no matter who it is just a generic number. The state has a way that they can calculate individual positive cases. So it's a more sensitive metric versus the one that we're able to get on the weekly updates. Because they're kind of pooling multiple testing sources into that number. So, it's not just what's coming out of our testing site. They have to tease out what's coming in from every lab that's reporting to the DPH system. So my understanding that they don't have the sensitivity on each of the 351 communities to tease out that more sensitive metric. So they're just purely looking at, how many times somebody, tested positive and then tested negative, or just tested negative. Some people they have to go for work, they're going for travel, they're going for multiple reasons and being tested multiple times a week. So yeah, sorry, that was kind of a long answer.
No, that's okay. I feel it's important to understand what that number is exactly showing us, because it does look, it's right on the borderline and it looks high, and it's important to understand how accurate that is.
Mm-hmm.
Anybody else have, Ms. Howard?
So I just had one question for Meredith, just for clarity around what Astrid was referring to when she talked about the contact tracing. So right now, just because I am working, we're working hand in hand with the town in terms of the contact tracing, because we have so many staff members in school. So since actually August 31st, our staff members have been physically coming into work. We have been fortunate that we have only had to do contact tracing on 3 occasions since our staff has been back. But in terms of the town's ability, I know right now, if and when we can, we'll free up our nursing staff to help on the town side, and the town is certainly helping us on a daily basis. But is that sufficient right now in the town to do the tracing with the numbers of people that you're having to deal with unrelated to the school, but obviously on 3 occasions it's been related to the school. So is there sufficient staff on the town side to do that contact tracing? And when we do go back to school, sort of what's the impact of that? And I'm thinking from the perspective of wanting to make sure, so my goal is to make sure that all of the controls that we have put in place to keep staff safe, to keep families safe, to keep kids safe, that when we do have an incident in school, which will happen, I mean, that's not, it's not rocket science to say that that is going to happen. I want to make sure that the strategies and protocols that we put in place can be accomplished, and I think they can. But right now, how does that look on the town side with the numbers being what they are on the town, and then the impact of the schools, and sort of how, I know we've talked a little bit about how we can help with that. And we have onboarded, because we have COVID medical waiting rooms now in the schools. So we have our regular nurses station, plus we have a COVID medical waiting room in the event that a staff member or a student is presenting with symptoms. We have hired CNAs, certified nursing assistants, to help manage those classrooms and keep kids or staff safe when they're in the COVID medical waiting space. But the contact tracing piece, I'm sort of unsure on.
No, that's a great question. And I think we all understand at this point how fluid this community is, and that, I think, I'm sorry if I'm kind of a broken record, but, so many of the great things about this community is that it is so interconnected and it's intergenerational. And, but when we're talking about disease transmission, there's also an increased risk of that. So in terms of like looking at this as just schools and just the town, we need to acknowledge like that fluidity, and that, I very much from the beginning of this pandemic have had my eyes very honed in on the very young and the very old, for just because we know that those are the most at risk. So, and also as, on my other hat, like also as a parent here in this community, like the school population is very important to me for many reasons. I come into this as a pediatric nurse, trained as a pediatric nurse. So that is like where my comfort zone more or less lies. So that being said, I have to do my job really well and very diligently to prevent an active case walking into the school. And then we have those protocols, and I trust those protocols, and I trust implicitly the staff and everything that is being done. We definitely were feeling overwhelmed when we were having 20, 25 cases come in each day. We had a 3-week period with 228 cases, which put us, greater than 1/3 of our total cases came in a 3-week period. So there's a lot of work that goes into that. We try to lean heavily on the contact tracing collaborative during that. My sense is this past October into, from October 21st on until really just teetering out this week. I live here. I understand this community a fair amount. So I like to take control of those investigations personally, to make sure that nothing is getting dropped. And that's just me because, I feel like I have a quicker sense than somebody that's sitting in an office, 4 towns away trying to understand our community. So does that overwhelm us a bit more? Probably. But really all that means is I walk around with a notebook and frantically jot down, various notes and, and going and, on my phone for 18, 19 hours a day. Is it overwhelming? Yeah, it can be. So, talking about all of these upcoming events, we know that the public health system is very much taxed and nearly shattered through this pandemic. We have done a good job of building up that a bit and working in conjunction with the schools and tapping into the use of the school nurses during this to do contact tracing. The whole idea of the contact tracing collaborative on the state level is amazing. But what is lost in that is that model is built. It's built on the premise that you're utilizing people within the community because they're trusted members of the community. And so that's why it works a little bit better when we're using already established, known, trusted people in our community to do the contact tracing. So that's kind of a long story, but I would say that, when our incidence rate is upwards into the 30s to 40s, like approaching 50, that's really where I feel that the systems are starting to get taxed, and I don't want those systems to be so taxed at that point that we lose the ability to maintain and keep the schools safe. So that's why, and unfortunately, opening or doing anything during the pandemic, we've all seen it's like a 2-week lag. It takes like 2 weeks to flush out. If there's like a large event, a large cluster, things like that, it takes 2 weeks to see the whatever collateral that comes out of that. And it's kind of like a pause that we need to watch and surveil at that point. So.
Thank you. It did help me because, we think about that trust factor is huge, in terms of contact tracing and having people feel comfortable in sharing who they've been with or who they've been around. And that totally translates into the schools. Obviously, we've dealt with it with some staff members where they're more comfortable talking to known people than just getting an agency from the outside, if it even exists, to come in and help with that. And if people aren't comfortable in talking about it, then we miss people who they may have been in contact with, which then can lead to further spread. So I think, it's hugely important to make sure we maintain a sense of control over that and continue to work together. So thank you for that. It definitely helped me understand.
Okay, I just wanted to address the statement that we're not looking at the whole picture. I have a child in the system myself, and I look at the big picture and the whole picture every time I make a decision when it comes to whether or not we're going remote, hybrid, and the sliding scale of when and where it's going to happen. This has been one of the most difficult decisions, every one of them, in my personal and professional life. So I look at every single time I make a decision, I look at how it's going to affect students. And I don't think I speak for myself. I think I speak for all of us, that we all consider the students with every decision that's made. And so does the district as a whole, the teachers, the administration. We're looking at the best for these children. And no matter what decision we make, there's going to be a group of people that are not going to be happy. And that's unfortunate. But we're trying to do what's best for the community, and we're trying to do what's best for the children. So I just wanted to raise that issue. Thank you. Does anybody else have anything to say? Yes, Ms. Powell.
Through the chair, I just have a question follow up for Ms. Hurley. When you talk about that 2-week lag, can you talk about what the implications of that, both for the upcoming holidays? We've got Thanksgiving and then followed by Christmas and New Year's.
Yeah. So the reason why we look at that 2-week period, and of the 715 cases that we've had here, the majority of which I have at least had some hand in some capacity. So what I can tell you is that, we look at the infectiousness of this virus, which we're still learning so much about, but there are people that will be exposed and then, they get tested on day 4 or day 5, which is kind of this sweet spot where we start to think, yeah, there's a higher likelihood people will test positive. But I have seen people test positive or become symptomatic on day 12. So like, if everybody's, if there's like a gathering of some sort or some sort of exposure, it doesn't have to be a gathering, it could be, if there's a breakdown of mechanisms in some capacity, and then, we go through and we say, oh, 5 days later, like if it's really a concerning exposure, a more high risk exposure, and then we go through and, that's why the 14 days is that protective barrier to kind of watch and make sure, because, what Dr. Wines was talking about also is that, there's from the point of exposure to the point of symptom and, we have a latency period, we have an infectious period with this virus. So unless it's very quick where, especially within households, if somebody tests positive and is asymptomatic and we're able to isolate them very quickly, that's perfect. But if somebody is already shown symptoms, then there's going to be like a household spread, most higher likely. So we like to give that 14-day period of any of their close contacts to a confirmed case to make sure that there's not going to be that person, a breakdown at some point. So especially if somebody, the worst case scenario is that somebody tests positive on day 12 following an exposure, or starts to become symptomatic on, a day 12, day 11, and then, and is then ultimately exposed all of whoever else they've been around.
Okay, thank you.
Does anybody have anything further for Meredith Hurley? Thank you, Meredith.
Meredith.
Thank you all.
All right, thank you.
Can I ask Meredith? Can I ask a question, please?
Oh, sure. Sorry.
Meredith, our positivity rate this week, I think Astrid said it was 4.85.
Mm-hmm.
Do you have what it was last week?
Last week it was 4.2, I think, off the top of my head. It was low 4s.
It is. I have it
So
right
we're
here.
moving up.
Yeah, I think because our cases have slowed this in the last, I know that we had like the 26 over the weekend, and but I think in comparison to the week before and how high our numbers were coming in daily that week, I do expect that we're going to see a decrease in the percent positive, but I couldn't say for sure because I'm only looking at really truthfully the numbers that are coming out of our testing site, just in terms of like number of people being tested and like that, whatever that metric is.
Thank you.
Thank you, Meredith. Does anything have anything further for Meredith? No. Thank you, Meredith. We appreciate it.
No problem. I'm going to jump over to the Board of Health meeting. So if any of you guys need anything, just text me and I can always switch back.
Meredith, if you could, if an official vote on their position, that would be very helpful.
See what I can do.
I already texted them and asked them that if they do take a vote to come back onto this meeting and give us that vote.
Thank you. Okay, I think we're moving on now to public comment. Do we have any public comment, Ms. Gallivan?
We have one person, two people, oh, a couple more popping up. The first one is Todd S. I assume Todd Sacco?
Yes, thank you. Thank you. And give me 1 second here. I just want to ask the chair, do you have some type of rules set up here? Time limits? Question. I know it's not a Q&A, but I just want to make sure we stay within the guidelines.
I would say 3 minutes would be respectful, and just to bring up the issues that we've discussed this evening, which is what was on the agenda, which is the community public health and the learning timeline, the return to formative learning timeline.
Okay, thank you.
Thanks.
So again, good evening all. Thank you for your efforts during these difficult times. I realize that, you know, this is really difficult and exhausting, I'm sure. However, it is actually to my great disappointment that I no longer have the opportunity to serve with you, because I feel like in times like this, frankly, and sorry, we need a little bit more backbone here. I do also want to thank you for the time to be heard. Before I jump into what I had prepared for this evening, I do just want to touch on a couple things. One, I want to thank Meredith Hurley for her feedback. And two, I just want to address the thinking about the kids. I'm with Julie, because all I hear every time is infection rates, infection rates, infection rates. It's going to bring home and kill somebody's grandmother. But we never talk about the data Julie brought up and what's really happening to the kids at home. So I second her thought. I'm wondering why we're hearing all this pushback to go back to school, and why we have a school committee, faculty, and administration folks who are lacking confidence that we can open safely when the data is clear that we can, including from what we heard from Astrid today, Dr. Wien, Dr. Wine, I'm sorry if I'm getting her name wrong. The experts have all been clear in the positions on going back to school, including the CDC, including the American Academy of Pediatricians. Both of these agencies have said the damage keeping children home is far worse than the damage of, or the risk of any damage of sending them back to school. And we just heard from Dr. Wien tonight that schools don't really have much of an impact on community spread. I also want to point out that none of the folks on the Board of Health are epidemiologists. We have not heard from any epidemiologists. So we really have to take some of this with a grain of salt. They're an advisory only, and their vote means nothing. Couple of places where I want to point to where the data is clear. Europe is in total shutdown right now. Total shutdown, but their schools are open. This was a country where early on in the pandemic, we were told to emulate them in regards to their response to the pandemic. Now that they're in total shutdown with the school still open, suddenly we no longer want to emulate them. And I'm not pointing to the school committee directly. This was more of a general consensus of Americans, okay? Regardless, they're spiking more than we are, and they're still going to school. But to get a little more closer to home, Florida, the state the rest of America scoffed at during July and August when they weren't social distancing and they weren't wearing masks, and their infection rates, here we are again, infection rates were spiking. They're actually doing better than we are. And here's what's notable about them. Their positivity rate during that time frame, since we want to talk about positivity rates all the time, was 4.2% in July and August. However, their 7-day average trend line on fatalities, meaning deaths per day over 7 days, was 175. More notable is now, October to November, with a positivity rate higher of 7.2% across much higher testing pools, meaning they're testing way more people than they were back then. So not only an increased positivity rate, but the baseline number is much bigger. And their 7-day fatality trend line is now on average of 7 days, they average 60 deaths. I know all deaths are horrible. We're in a pandemic, there's not much we can do. So the bottom line is you have the data. The middle of the country is open and playing sports. Florida is open and playing sports. The European schools are open and engaging in sports and activities. So I asked this final piece. Where are our heroes? Our school committee is elected to manage the budget and work in the best interest of the children. Where are you? From the faculty, where are you? I hear that many of you are not in agreement with the WTA leadership and want to come back and teach. Why aren't we hearing from you? Why aren't you speaking up for the children of our community? I, for one, truly believe in the teaching profession and its role in our great society. I am befuddled by the idea that someone who can hit a curveball can make millions playing a game that they love. But someone who has the opportunity to mold young minds and have a real impact on our society at large has to take wages that are frankly insulting, in my opinion. That said, teachers that I went to school with, who I still friendly with, talk to me now about the same issues, and they think that even though the pay was low, the lifestyle was pretty good, and there's nothing more rewarding than teaching children and getting that feedback. Everything is a matter of perspective.
I don't mean to interrupt, but you're going to need to wrap up. We've gone over the time limit.
Okay. The only thing we do know is our children need you right now, and we're not hearing from you, and it's in bad form. It's in bad form because we certainly hear a lot from you when you're in contract negotiations. Please restore my faith that for the majority of you, it is truly about the kids. Come out and be heard, because I'm having a real hard time reconciling that in my head now.
Thank you, Mr. Sacco. Ms. Galvin, do we have another? Mr. Matucci, do you mind keeping time for me, please? I lost track on that.
Yeah, we have Alyssa Deja.
Can you hear me?
Yes.
Okay, great. Thank you. My name is Alyssa Daigneault. I am a teacher at Winthrop High School. I've been a high school teacher for 20 years. I am not a member of the Teachers Union, and I'm here to talk to you about my experience from the eyes of my classroom. Before I read you what I wrote, I just want to thank all of the people that volunteer their time that are a part of this call. It's not lost on me how much time, energy, and effort everybody is putting in to this entire effort of trying to make the best choice on behalf of not only the children in our community, but also the community members by extension. As a teacher, I am in the relationship business. Relationships are what drew me into the classroom 20 years ago. Relationships with colleagues, parents, community members, and students, they stand the test of time. And they are the reason I hear from my students decades after they have left our classroom. They are at the heart of what we take away from Winthrop Public Schools as students and teachers. The essence of these relationships is what we remember the most from our experience in school. In many ways, these relationships lay the ground floor of a foundation of feelings we all have about school and learning. Reflect on your own experience when you were 6 and 12 and 16. Who do you remember? The good and the bad. Each of these relationships taught us something about ourselves and in many ways shaped the learners that we are today. Our confidence, passion, and persistence are all born from the small moments we have interacting with our teachers, coaches, and mentors as we grow during this important time in our life. The relationships between students and teachers are suffering, and in many ways, sucking the life out of school. I see it in the faces of my students across a silent screen each day. This is not the school we remember. With all the lesson planning, tactics, gadgets, and humor, I still cannot feel our relationship grow in the same way. School is so detached. It's a thing that we get up and check the box to do every day. It is the antithesis of what I signed up for as an educator. A fancy knowledge dump and the filling of a proverbial pail. It is not the lighting of fire that keeps the love of learning burning long after we walk down the graduation aisle. And this deterioration is no one's fault. Pointing fingers and blame divides us all and serves only to build our frustration and anger around a topic we can't control. We're all trying our best, building the plane as we fly. And if this is a plane of education, it's going down. Students are depressed, anxious, frustrated, and disenchanted with school. At the heart of it all, by and large, we're failing. And this is really hard to talk about. It's hard because we just don't know what to do to make it right. Agonizing over what to do to make it right brought me to the heart of this message and into this meeting today. We need to do anything we can to help build the connections between teachers and students. These connections cannot be built in Zoom. God knows I've tried. 6 months of trying everything I can to connect in a meaningful way with students I've never met and students that I've known for 15 years. And it's just not good enough. Not for my students, not for my children, not for your children, and not for our community. We need to be together in our classrooms, safely, but in person. It's the smile, the giggle, the sigh, and all the nonverbals in between that are missing from our world. We need them, if only for a couple of hours a week. Anything will be better than nothing. Each moment, we will slowly build the connections needed to transcend our Zoom moments and breathe some life back into school. I recognize this plea comes with sacrifice. Maybe it's asynchronous learning or a slowdown in curriculum, the loss of some staff, more technology issues, more confusion, and everything in between that we can't see as we try to save this falling plane. But I believe it's worth it. I believe we can make a step into hybrid learning safely. And most importantly, I believe that in the couple of hours a week I get with your child or your neighbor or your niece, it's worth it. It's not going to be perfect, but it's going to be a step in the right direction.
Melissa, I think you've gone over the time, and I'm just asking if you could just possibly wrap up, and we appreciate your comment.
Yep. Yeah, I'm almost finished. Thank you. If I knew I had a time limit, I would have shortened up my speech. This is an urgent issue. You know, I don't want to make light of it. With each passing day, I can see my students' enthusiasm and hope fade. They're desperately trying to do well, and they're clinging to the next thread of hope dangling in front of them. Let's give them a chance to reignite the flame and keep their love of learning burning. Please open up our schools in a hybrid model for the future of our youth and of our public schools.
Thank you, Melissa. We appreciate that.
That's all I have.
Ms. Gallivan, do we have any other public comment?
We do. Next is Sophia Vitale.
Hi.
We can hear you, Sophia.
Hi, Sophia.
My name is Sophia Vitale, and I'm a senior at Winthrop High School. I believe now that we are in the yellow that we are definitely clear to go back to school. Also, Governor Baker stated that schools should be going back. Education is important, especially for students that are applying to college and entering adulthood. I miss being able to talk to my teachers one-on-one without others having to listen. With in-person learning, I know they are all available. I want to be able to talk with my guidance counselor about my next steps in my life. I find many resources at school that I am unable to attain at home. For myself, school has always been something I look forward to every day. Now it makes me not even want to get out of bed to grab my computer. I believe a lot of students will choose to stay home, and that's okay, but students who want to be back should be offered the opportunity. With that being said, having less kids in school, it would ultimately be a safer environment for the students who believe their education is a necessity. High schoolers and middle schoolers are completely capable of washing their hands, distancing, and sanitizing properly. I believe that the model of some kids in the classroom and some on Zoom will be the best fit for everyone to get education that feels comfortable for them. Many schools are currently doing it and have been very successful, and I'm confident that Winthrop Public Schools can do so as well. Further, I would like to know what the school administration thinks is the appropriate time to go back, and what do they feel comfortable with. Obviously, the virus is not going away in the next month or even in the next year, so I would like to know where that leaves us. I hope that you all, as well as teachers, can help us students out, because we are losing a lot of education from the remote learning model that we have now, and it's very upsetting. I hope that you all take these comments into consideration. Thank you.
Thank you. I appreciate your comment. Ms. Gallivan, do we have any other public comment?
Yes. Next is Jenna Dorr. Jenna, can you hear us?
Hi, can you hear me?
Yes.
Hi, Jenna.
Hi. So can my sister, Mara, can she go after me? We're on the same computer.
That's fine.
Thank you. Good evening. It is with great concern that I am calling in tonight to address our plan to return to school. I have been fighting to get back since the beginning, and I believe that there is no fight left to be had. We are in the yellow. The state is telling us to go back to school. This is what we had been asking for. The metric has changed to help smaller communities like Winthrop. Serving on the school committee board is not just due to personal need, but the public need. The state is telling us what to do, and for the past 9 months, all we've been listening to is the state. I am worried about my mental health and my education. I have applied to 9 colleges on my own so far, with little guidance available. Next year, when attending one of these colleges, I will be in class with students from all over the country who have been back in school. How will I be able to keep up with students who have been receiving an in-person education? This damage is irreversible and will have detrimental effects on our future, from kindergartners up. As I have stated in my email to you all, I am willing to sit down with you and work through the details. The students are the ones going through this and have a lot of insight. Some are just afraid to stand up. I really do appreciate all of the work you have all done. It's not an easy job, and I have learned that standing up takes a lot of courage. As leaders, I'm sure you all know this, and despite personal beliefs, I hope you choose to stand up for the children of our community. Thank you.
Thank you, Jenna.
Good evening. My name is Mara Dorr. Thank you all for your continued work.
Education is essential, and I strongly believe it is time for us to be back in the classroom. There are plenty of towns around us who have successfully gone back fully in person or hybrid. This includes public schools, private schools, and vocational schools who have students coming in from all different districts. It is not fair to students of Winthrop who are suffering at home. Kids have lost so much over the past few months. Adults have the luxury of going out to dinner, going shopping, even staying at a hotel and going to a casino. Not all kids have access to these amenities, which have all been reopened. Why are we not prioritizing the children who need it most? What is it going to take to give kids the education they deserve? I hope you can listen to the survey results and let those who want to go back, go back. My whole life, teachers have told me to stand up for what I believe in. I believe they are essential workers, and I believe we should be getting an in-person education that we deserve. Thank you.
Thank you. Ms. Galvin, do we have any further public comment?
Yes, we actually have quite a few. One just disappeared. Next is Susan Leonard. Sue?
Hello, can you hear me?
Yes.
Great. I will be brief, and I want to thank you for your time and your consideration this evening. And I just want to say that the impassioned calls for us to go back to school really resonate highly. I think the thing I just want to add, and I just want to ask, is that maybe this could be done on a school by school basis. I have a kindergartner, and for my daughter, and for I think a lot of people in a very in younger children, it really seems to be working very well to do remote only school. And I completely understand and respect the fact that that's not the case for all students, particularly students in the middle and high schools. So I think the point I just want to make here tonight is that there maybe is not a one size fits all solution for this problem. And I would just encourage the school board to let our leaders, our administrative leaders in the various school systems, make a recommendation for their students and their parents. Again, I think that for GFB, for example, we would really benefit from staying online, but I understand that for other school systems in the town, that may not make the most sense. So please listen to your parents and consider the fact that the needs of a second grader are not the same as the needs of a junior in high school. This is not a one size fits all issue. And I think that if there is some way to account for that, it would be very much appreciated. Thanks for listening.
Thank you. Ms. Calvin, do we have any other public comment?
We do. Next is Jean Holgerson.
Jane, are you on the call?
Oh, she's using an older version. Hold on. I have to move her over. Ms. Holgerson? Ms. Holgerson?
Sorry.
She might have to try one more time. Okay, next up we have Elizabeth Huffle.
It's Poofall Jones. So
sorry about that.
That's okay. Nobody can pronounce it ever. No, I just want to thank you all for taking this time and for the consideration of this hugely complex issue. I mean, a decision in one aspect of our community system affects every single other aspect of our community. So I know that you all are trying to figure out the best way to make this decision. So I just appreciate that. And unlike almost everybody else, I didn't prepare any comments. And I don't disagree with many of the arguments that I heard tonight. I myself do research in education and child development. So I know that education is based on relationships, and those are so essential and important. But I also know that we have a public health system that is screaming at us right now to pause on things because we are going into the 2 worst months of this year. And so I want my child back in school. We have conversations about I have 2 children, one in kindergarten, one in 3rd grade. We have conversations about how she longs to see her classroom and her friends and her teachers. But we also talk about the safety concerns. And I think that we can go and open our schools and have these wonderful relationships. But I think we should heed the advice of the public health people, both in our community, and I know they haven't taken a vote yet. So, you know, you all can wait on their vote if you'd like to. But I also know that the public health sector in this country right now is saying we all need to pause and pull back. And what have we said about this from the very beginning? If we had acted sooner, if we had acted preemptively, as opposed to waiting for the crisis to come, then we would be like other places that are open. And I would just like to add, like, thinking about, you know, Europe and other places like that, they are locked down and everything else except for the schools, but we're not locked down anywhere else, and we're going to reopen something else. So I think it is such a complex problem. I do not envy your position, but I think waiting until January and doing it then after we've had our 2-week incubation period is a better option. So thank you.
Thank you.
Any further public comment?
Yes, we have. Where'd she go? Beth Zarega. Beth, can you hear us?
Yes, I can. Thank you. So thank you all for taking the time tonight to, you know, share your thoughts and listen to the community. I am the parent of a 1st grader in Winthrop. I am also a higher education administrator who works very closely with college students who are incredibly impacted by the pandemic right now. The concerns that the high school students mentioned earlier in this call, I am seeing that firsthand in conversations with current college freshmen. That said, I feel that equity is incredibly important. And if, as a school district, we are not able to equitably support students who must remain remote for legitimate medical reasons, while the rest of the community goes back to hybrid, I believe that we need to reconsider this decision. As I understand from the current plans, that the Gorman Fort Bank School will have 0 live instruction possibly for students who are fully remote. And I feel that that is something that's going to truly abandon some very, yes. Do you want to? Okay, hold on. Sorry, said 1st grader is getting ready for bed. I feel that students will be, abandoned if they don't have these relationships, as we've been discussing, these important relationships with their teachers. And I want the school board to be fully aware that in making this decision, those youngest, most vulnerable students, if they are not able to return to school because they have family members who are high risk, they will be losing their classroom communities. And I also am somebody who likes to work with data. I have taken a look at all of the other yellow communities in Massachusetts. As Meredith said, our current incident rate at 62.1 towers above those other communities. The only thing that's keeping us yellow right now is that 4.85 positivity rate. So I believe that that also deserves consideration. If I had a student in, and just going down the list here, Swampscott 10.5, Stoneham 15.1, just looking at some others here in the Boston area, Boston at 23.1, all of these are incident rates that are way lower than where we are right now. Brookline is at 4%. I would be more than happy to have a student back in school in Brookline with a 4 cases per 100,000 incident rate. So I believe that these are all things that need to be taken into consideration. While I do, as I said, truly understand the need for community and relationships amongst all of our students in Winthrop. Thank you.
Thank you, Beth. We appreciate your comment.
Okay, next we have K.O. Dwyer.
Good evening, everybody. Can you hear me okay?
Yes, Kay.
Hey, Chairman Perrin, nice to see you.
As well.
Well, sort of see you. So I'm going to be quick. I am exhausted by remote learning. My 7th grader is doing pretty great, actually. My 4th grader is distracted. My 2nd grader has an IEP and is getting by on charm and math skills. And my kids have really amazing teachers. My hubby and I are working from home, but I agree with the Board of Public Health. I think we could safely make this decision after the 2nd wave hits and we know what it feels like, or perhaps when we have a downward trend that lasts more than 7 to 10 days. The town's numbers are not a reflection on the leadership here on the call, but there is an indication that that perhaps post-Thanksgiving and post the December break, things could spin out a little bit. I don't want that to be the reality, but it is something that I feel like as we consider scenario planning, sound scenario planning led by the Board of Public Health and Meredith Hurley and all of the people on this call, including the superintendent, who's doing a phenomenal job under incredibly difficult circumstances. I just don't want Winthrop to be a case study about epidemiology, about disease spreading. And I really do want my kids back in school. I really want them to have that experience. And by the way, her name is Dr. Astrid Wines. She's an MD, PhD, and I thought she did a hell of a job tonight. Thanks, everybody.
Thank you, Kay. We appreciate your comment.
Okay. Next we have Orla Toomey. Ms. Toomey?
Thank you. And I just want to reiterate everything that Kay said. Dr. Wines, we're fortunate to have someone of her caliber in our community that can represent us with facts and data. I took notes during tonight. I think the 4.85 indicator is not comforting. And I know that we have to make a decision, but we live in the gray. It's a moving target. And I don't envy anybody, especially the school committee, that has to make that decision. I heard Mr. Sacco earlier talk about Europe, and I know that others have kind of spoken to this, but they prioritize schools over everything. So they close bars, restaurants, yacht clubs. So I think it's a community effort. And I heard this earlier in the meeting tonight. It's not just the school committee that are responsible for this. So it has to be a community effort. And then just a personal experience with Northern Ireland. My nephews went back to school and they're in lockdown. So we have to be able to stand behind our decision and be able to change it if it's the wrong one. So I just ask our school committee to consider all of those points that I've made.
Thank you, Orla, for your comments. I just received an email from Dr. Wines that the Board of Health has voted unanimously to recommend to the school committee to postpone any in-person learning until at least January 4th, 2021. The Board of Health will revisit this recommendation at our next Board of Health meeting on December 8th, 2020. And that is signed by Chairman Bill Schmidt, Dr. Astrid Wines, and Susan McGuire. That email was sent at 6:51 p.m. tonight to myself and the superintendent. I'm sorry to interrupt public comment.
Ms. Toomey, do you have anything more?
No, I think that was a great update as part of my comment. I think it's everything that I wanted to hear.
Thank you. Next, we have Wendy Millar Page, excuse me.
Good evening, and thank you all for your continued community service on behalf of our children. As most of you know, I don't have any eggs in the basket, but I stay very connected to the school through the dramatic arts and things, and still very proudly participate as alumni in keeping things going. I work in a COVID response team for another city. My understanding was that we have to be a solid 3 weeks straight in the yellow to be able to return to classroom. I was looking for a point of clarification. Is that something that has changed that I'm not aware of? Is there, I know it's not Q&A, but if that's something that we could talk to, so that if we were yellow last week and for this week we came into red, we start over again, is my understanding. I just want to make sure that we're all working from the same information. And that was my only reason for coming into public comment, and to thank you for having to make these hard choices.
Thank you, Wendy. Thank you for your comment. Ms. Howard, do you want to clarify?
Sure. So maybe just repeat, if Wendy, are you still on? She jumped off. Brian, can you just, I wasn't sure if she was asking if we were already in and turned red, or if we were during our waiting time and turned red, because the idea of watching data over a period of time is to see how that data fluctuates. And I think it has to all be kept in perspective. So if we went into the red by 1/10, I think that you have to look at that reasonably, and reasonableness means a lot. There's no
Lisa, Ms. Miller's back on in case you had a clarifying question.
Yeah. So Wendy, are you there?
I am. Thank you.
Hi. Thank you for calling. We typically don't answer any questions on public comment, but I do think this is something that requires clarification for those who are still on. If the school district, when we look at the data over a minimum of a 3-week period, we're looking not just at numbers, but we're looking at just sort of overall trends on top of everything else we look at. So I would say that if we were to go into the red, we'd have to look at a whole bunch of factors. Why did that happen? Was it a specific cluster of an event that may be completely unrelated? I mean, we don't have the kind of the top two, the jails or the really large assisted living facilities. We do have one within the community, and if we were put into the red because of an incident such as that, that would be something that I think we would really have to look at and discuss with our town nurse and the Board of Health, because that would be a factor that would not be typical. And so to say that that would throw us back into starting over, I would say that that wouldn't be reasonable in a situation such as that. But there's no rule that says you have to start over, just like there's no rule in terms of what happens after 3 weeks. It's not an automatic flip of a button that you go hybrid after 3 weeks. It's part of the consideration. And the idea behind the 3 weeks, according to the commissioner, is to look at stability and your chances for stability. Bottom line is, you don't want to put kids back in school only to have to yank them out, quickly again. So it's a long way of saying, no, you don't necessarily have to start over, but you really do have to look and really look at the data that, and in terms of your decision making. I mean, what are you looking at? What were the numbers like before? Where does it look like we're headed? Those are all the factors that come into play. I hope that wasn't more confusing.
I think that'll be helpful for people to understand that, because a lot of people are saying, we have to wait 3 weeks till we're in yellow before any decisions can be made. And I know we haven't hit that yellow factor yet. And my fear was if we flip to red in the next week or two, that people would be under the impression that no matter what decisions are made, it gets pushed back again.
Yeah, so I would say 3 weeks, when the district turns yellow as we did, or the community as a whole turns yellow as we did, looking at data for a period of three more reporting periods is sort of the baseline And how that data looks, it just depends upon what the numbers are and what all the other mitigating factors are. But I've never been of the opinion, nor has that been shared with me in any of the meetings I've been in with other superintendents or the commissioner or associate commissioner, that that you have to start over.
Excellent.
You may need to if you know you were yellow by a hair and then red and red. You know, one would say that wouldn't be reasonable to say, okay, this looks good. But again, there's so many other, that one number is not what does it for us in terms of decision making.
I think that's an excellent point to make very clear to the residents in the community.
Yeah,
thank you.
Thank you. Thank you, Wendy.
Okay.
For clarifying.
Next, we have Annika Holgerson. I have to move her back in as well. Hold on. She's on an older version. Annika, can you hear us?
It's actually Jean Holgerson. I got kicked out of my computer somehow. I don't know, it said the host kicked me out, but hello, how are you all? Thank you for having me. Before I talk about what I prepared, I wanted to thank Dr. Wines for her presentation, but I also wanted to speak to the fact that I know that she's highly recommending that we don't go back in Winthrop, yet her children are in a German Boston school, which has been in a red zone for a long time, and her children safely go back with masks, hand washing, and sanitization. So, I mean, I feel, you know, a little bit slighted that she's recommended and it's not safe for our children, but it's safe for hers. So, also, we know Governor Baker has said that the school spread is not happening. Even Meredith said that we're trending down, and in his new metrics and his measures, there's no trending at all right there. So anyways, I'm the mother of 4 children in the school system. I'm also a healthcare professional in the community. And I feel that we need to get our children back to the classroom now. All right. We have been promised by the administration and the school committee since September, once we are out of the red zone and our students can return to school. Collectively, you have all failed to keep your promise, as we have been in the yellow zone for 2 weeks. Reminder, there is no mass COVID rule from Governor Baker on the yellow period. Okay. We as parents continue to fight for the children of Winthrop, despite your broken promises and unfair treatment. This administration and the school committee continue to find reasons to keep the children home, even though Governor Baker is instructed Massachusetts schools to reopen classrooms.
It's 8 o'clock.
Even in communities with surging COVID-19 cases under the new Massachusetts state rules, schools and classrooms should be only closed as the last resort, not the first resort, not the middle resort. Even when there is evidence that communities have COVID-19 positivity rates that are exceptionally high, we're still supposed to be in school, okay? Even in the red zone's hybrid, yellow is full-time. That's what they're recommending. We have been diligently following Governor Baker's recommendations since the pandemic began last March. We must continue to follow the recommendations of our governor. You cannot pick and choose when to decide to follow the governor's rules and when to ignore the rules. We parents have been promised by the administration and the school committee that once we're in yellow, our children can attend school. Is this just a lie to appease us or to buy the Teachers Association more time? Winthrop parents are sick and tired of these shenanigans, and we collectively will take whatever measures we need to do to seek justice. As a taxpayer, it is our fundamental constitutional right to educate our children in the school institutions. This is about choice. We all deserve to have a choice. Some students choose to stay home because a family member is elderly or compromised. That's their choice. If I want my children to go to school, it's my choice. It's about time we put the children first. You have all failed the children of Winthrop. I certainly hope that you will make the right decision tonight. Thank you.
Thank you, Ms. Holgerson. Any further public comment, Ms. Gallivan?
Yes, hold on. We have Bruce Walker. Mr. Walker?
Hi, I'm sorry, I'm logged in through work. It's actually Marissa Ferrara. Sorry. I got kicked off earlier too. I don't know what's going on with my Zoom, but thank you so much. I'm going to be super brief tonight. My name is Marissa Ferrara. I'm the parent of 4, a 12th grader, a 6th grader, a 4th grader, and a junior in college. I'm also the WHS Senior Class Advisor, and in my professional life, I'm the Manager of Executive Administration, Education, and Events at the Reagan Institute of MGH, MIT, and Harvard, which is a scientific research institute which studies the human immune system to fight and cure disease. And I work every day with physicians and scientists studying SARS-CoV-2 and COVID-19. I want to start off tonight by saying how incredibly proud I am of the seniors tonight who got on to speak, Sophia, Jenna, and Mara. I think for them to take a stand and get online and speak in front of a large audience to voice their opinions and what they're going through on a personal level, I'm just super proud as their advisor and as a parent. I also want to thank Alyssa Dainu for being a teacher's voice tonight. Her words were super impactful, I know, to me as a parent, and I think that they were very needed for all of us to hear. So thank you very much, Alyssa. I just wanted to urge the committee to stay on course. We've been hearing the word expectation since August. We've been told that the DESE expectation is as close to a mandate as we can get. And I think that we just need to not move the goalpost halfway through the game. The expectation right now for a yellow community is full in person. I understand that we need to walk before we run, but let's get hybrid going. We need to get these kids back in school in a safe way. Masks work. They will work in a school setting. They have worked in a school setting. We see it across the state. We see it across the country. Please stay the course, follow the state and DESE expectations, and please have our children return back to in-school, in-person learning. Thank you.
Thank you, Marissa. Thank you for your comments. Any further public comment?
Yes, next we have Connie Grayson.
Connie?
Hi, everyone. How are you? Can you hear me?
I hear you, yep.
I just, my daughter's gonna,
She's gonna turn her volume
I
up.
just want to say, I think you all know me. I've been a teacher in the school system for 39 years, 39 marvelous years, and I've never experienced anything like this. I do have to say, I disagree with some comments. I see my students come in very highly engaged, happy. I love my good mornings. Do I miss my hugs? Yes, I miss my hugs. Do I miss my high fives? Yes, I miss my high fives. Do I miss groups, seeing groups working together? I have that on Zoom. They're working together in small groups. When I do a SEL check on them, 1 to 5, 5 being the best, and I get a 10, I know they're still happy. I don't see these depressed children that some people see. Do I want them back? Yes, I do want them back. Do I want them sitting in front of me? Yes, I do. But do I want to support my superintendent? Yes, I do. I think she's made some really valid points. Let's just wait till the holiday season is over. I talk to my students. I hear from my students the different places they are going for Thanksgiving, the different places they're going for the Christmas and New Year's, and then they're going to come back in the classroom. Do I feel that's safe for me? No, I do not. Do I feel it's safe for them? No, I do not. Do I feel it's safe for my colleagues? No. So I support what Superintendent Howard is saying. Let's just hold off, not just not have them come in. I want them in, but hold off and wait till after the holiday when these kids are going to be visiting, and I'm hopefully will be able to visit my family and friends in a safe environment and not feel unsafe. It's not going to be productive when you're teaching in an environment when you're not feeling safe, being in that environment, and you're walking on eggshells, trying to make it a safe environment. I hope you will support Lisa Howard, and thank you for supporting me over all these years.
Thank you. Any further public comment?
Yes, next we have Andrea Hurley.
Hi, can you hear me?
Yes.
Hi, can you hear me?
Yes.
I'm going to keep this short and sweet because I think we all know where we stand at this point. I'm a parent of 2 boys, currently a senior and a sophomore. Hold on, turn off my TV. I'm not going to get into logistics because I think at this moment we have a pretty great understanding of the guidelines put into place. I just feel like this isn't an election between hybrid versus remote. This is about personal choice and respecting each other's decisions. If I want my kid to go back to hybrid and people want to keep their kids home for remote, that should be a choice. The state changes its guidelines, obviously, to make it fair in a town of our size. And then a survey is sent out for the 3rd time, making changes for the hybrid model at the elementary school level to obviously get a different outcome from families. Children are suffering. I know, the teacher that just spoke said children aren't suffering. Well, they are. I mean, they're suffering all over this country right now. Okay. And I feel like these kids are being punished. And I know there's teachers that, still going to the gyms and going out and bringing the virus into the school as well. So let's be fair. It's two-sided here. I understand staffing is an issue. It's time to think outside the box and get these kids back. The community at this point understands what the virus is about and use proper safety measures. The students are willing to do whatever it takes. It's time to return our kids to school. None of this has been easy for anyone nor taken lightly. However, here we are again making public comments. It is currently being done safely. I understand that you're all put into these positions for a reason, and there will be times that you'll have to make tough decisions. In my opinion, keeping these kids home this long has done more harm and will have long-term effects on them. Don't ignore the facts that these kids are depressed. Go ask the doctors and professionals. It's very disappointing that as a president of the teachers union represents just the teachers that don't want to come back, when I know for a fact there's actually teachers that do. Let's be fair and let's represent both sides. Bottom line, this decision is one-sided, and someone needs to take a stand and fight for these children and separate business with personal in making these decisions. Please give these kids a chance to open the school safely. And Julie said it best. It's never going to be a right time to do it. So let's just open the doors, do it safely, and get it going. Thank you for taking the time to listen to me.
Ms. Gallivan?
Yes, we have Dawn Lettieri.
Dawn.
Hi, I'm Dawn Lettieri. I've been a proud Winthrop school teacher for 36 years, and I'm a proud member of the Winthrop Teachers Association. I just want to start by saying remote learning is in no way ideal. I love my students. I love seeing students every day, and I can't wait for them all to be back in our building. However, I do have to disagree with what Alyssa is seeing at the high school, because what is happening at the ATC is amazing. I am in classes, in and out of different Zoom meetings every day. I go into multiple classrooms, and what I see is fabulous learning and teaching. I see student collaboration. I see smiling faces. Every day, I see amazing things taking place at the ATC. Today, I saw a young boy who's quiet create a video to be shared with his classmates. He showed them how to do double-digit multiplication using the distributive property. And this boy most likely would not stand up in front of his classmates in a classroom, but he has some confidence now and he can create videos. Again, I don't think remote learning is an ideal situation, but what I'm seeing is tremendous. We have great online programs that provide engagement between teachers and students. Our teachers have created a wonderful school library that is all done online. The kids can come in, parents can come in and pick up books. And then when the kids are finished, they can drop them off. So kids get to, it's like shopping online shopping. They can go in, they can pick out the books that they want. And those books, I know a teacher, one of our 5th grade teachers, and probably other teachers, who actually deliver the books to the students at home. We have great collaboration among students. We're doing all kinds of breakout groups. We're providing excellent materials on our materials pickup days. We are still conferencing with parents, through Zoom meetings, still having all of our teacher meetings. Again, it's not ideal, but every day, an average of 95% of our students are attending the ACT. We love our kids and we want nothing better than to see them back at school, but we know that we need to do it when it's safe. Thanks for listening.
Thank you for your comment, Dawn.
Thanks, Dawn.
Okay, we have Grace Galouris. I think I have to promote Grace. Grace, can you hear us?
Hi, can you hear me?
Yes.
Hi, my name is Grace Gloris. I'm a senior at Winthrop High School. I would like to speak on behalf of many of my classmates who are struggling with remote learning. These past months that we have been out of school have been extremely hard on students, specifically high schoolers. I live in a family with 3 high school siblings. All 4 of us are close each other off to sit silently and separately in a room where we will be staring at a screen for the next 6.5 hours. As students and kids, it is so bad for us to be sitting in the same chair, staring at the same screen all day long. The change in mood that I see in myself, my family, and friends is drastic. There is a big argument about how elementary students are seeming to be doing just fine with online school. Both the education level and maturity level are not even comparable between elementary and high school students. This is the last year I will be attending Winthrop schools. Not only have I been stripped of the events and memories that make up a senior year in high school, but now I might need to face the fact that I will never get them. This is the last year I have to spend school time with my senior classmates. Our mental health is suffering and our education is not where it should be. The stress students are undergoing is detrimental. Keeping students completely remote is very damaging. I am hopeful that you guys can follow the state guidelines in letting us return to school, as we are in the yellow and this is recommended. COVID-19 is a reality that everyone needs to begin to adjust to, just as any other obstacle in life. Both of my parents, as well as myself, have been going to work throughout this pandemic, as getting back to work is essential to our communities. I understand that COVID is real, but almost all students are not considered high risk. Teachers are the most essential of all of these workers. They help to grow and nurture the upcoming generation. I strongly believe that through safe guidelines and precautions, we can make going back to school work. I know we can make it work just as other towns with similar situations are. Thank you.
Thanks, Grace.
Any further public comment?
Yes, we have Bernadette Carsley.
Ms. Bouncey, how are you this evening?
I'm fine, thank you. And thank you all for the service that you do on behalf of the children of Winthrop. As many of you know, I've been a teacher here for more than 35 years. I really cherish my role as someone in the community who's met a lot of people. We all want our students back. My students have been incredibly engaged and their attendance has been wonderful during this time, which is totally a tribute to their parents and the excellent work that they're doing with their children at home. I would love nothing more to see my little lions back in the classroom, but I really only want to do it when I know it's safe for them and their families. I really do think that the most prudent thing would be to wait until January to avoid a stop and start. We know that inevitably when college students come home and families gather for Thanksgiving, December 7th puts us right in the middle of that spike. And I feel like it would be much more detrimental to have them start and then stop than to just wait until January and be able to have a continuous hybrid experience with our students. I also feel for the medical personnel. I know that everyone thinks that they're doing the best job that they can, but I know it must be incredibly frustrating for them to be in full PPE, down giving COVID tests to people, and look across the street at the park and see many children without masks outside. Yes, they're outside enjoying fresh air, but they're not properly masked. Those of us who are at work every day at the middle school can see children gathering outside on the field for organized practices, not wearing masks. And those are the children who will be coming back to our classrooms. So while I have no doubt that many people in the town are really taking all of the COVID restrictions seriously, unfortunately, many are not. And until we can be sure that everyone's going to follow the rules, I think it would be prudent to wait until January. Thank you so much for your time.
Thank you, Ms. Cassidy. Thank you very much. Any further public comment?
We have two who already spoke. Should I allow them back in?
I think we can allow them back in, but for very brief if they need to follow up on something. But I don't want to give a full 3 minutes. We've gone through everyone. So
Well, this is Todd Sacco coming back in. Mr. Sacco? Mr. Sacco, can you hear us?
Mr.
Maybe
Sacks? Okay.
Maybe he did it accidentally. I have one person, new person, Amy Cervelis.
Ms. Cervelis? You have to unmute. Ms. Cervelis, if you're calling and you need to unmute. I have nothing.
Yep. Well, she's unmuted though. Mr. Velez, can you hear us?
Any further public comment?
Again, I've got a couple that were here before, but let's see. Sophia Vitale?
Hi.
Hi, Sophia. If you just want to wrap up.
Yeah, I just wanted to follow up on Miss Lettieri's comment. I just wanted to say that I completely understand where she is coming from, and I'm so happy that her students are being provided with great learning and opportunities, and that they're very happy in the model that they are using. And I wish that the high school had that. I just wanted to say that in our model, more than half of the students do not have their faces on camera, nor do they participate in class. This does not make school enjoyable whatsoever. Some students do not even have the urge to turn their lights on in their rooms when joining a class. And it's extremely sad that this is how we have to spend our last days before we graduate. I appreciate all the teachers and administration. I miss seeing them in school, but maybe some things need to be altered in the high school. And Ms. Lettieri's comment shows that it sure can be accomplished. Thanks.
Thank you, Sophia. Anything further?
All of which were people who were here before. Mr. Sacco appeared again, so I'm going to try it one more time. Maybe he was having trouble. Mr. Sacco? It's like he's trying to get in, but not getting any volume.
Is there anyone further?
A couple more. Mrs. Toomey?
I think one thing that I didn't hear tonight that I really want to reinforce is that the current model is working for some parents. I mean, it's working for me, and I didn't think it would, but my children are so engaged, and that is a testament to this administration and the teachers and all of the work that they do behind the scenes. I mean, the communication is unbelievable. They tell me what I need beforehand. I help. And I know that this isn't the same story for everybody, but I didn't hear it tonight. And I think that anyone on this call that is a teacher or an administrator needs to know that your hard work is paying off and that it's working. So thank you.
Thank you very much. I think we're going to close public comment unless there's some new.
There's one new person.
After this, we'll close public comment.
Elisa Turner? Could you hear us, Elisa?
I can. Can you hear me?
Yes.
Hi, everybody, and thank you so much. I think we've heard a lot of great comments tonight. And I am a kindergarten teacher in the town. I have been so for 10 years. I think I have the best job in the world. This has been one of the hardest years, I think, of my life. I would love to have my students back in my classroom. And I just don't know if anybody knows what my classroom looks like anymore. There are 11 desks in my kindergarten classroom. And I don't know if anybody has ever been to kindergarten, but they don't do well sitting in desks. At least when I see them on a Zoom meeting, if I see they're struggling, I can tell them to get up and go get a drink or take a break and play with their parents or their siblings. And to think of these little bodies sitting in a desk is heartbreaking to me. I don't believe it's the best way that they would be learning. And the superintendent mentioned 2 groups of kids that we'd be thinking about, like our kids that are in person and the kids that are remote. But I think we'd have 3 groups. We'd have a hybrid group coming on Monday and Tuesday, a hybrid group coming on Thursday and Friday, and then a fully remote group. And meeting all the needs of those kids is daunting. There's nothing more that I would like to, the hugs that Connie Grayson mentioned, or Dawn Lettieri, and the high fives and just their smiles and their giggles. And I desperately miss it all, but I don't know if going, I believe that my Zooms are working. I believe that my kids are engaged. I've had feedback from parents that have said, God, I never thought they'd even come together as a group, but you know, they really are. And I don't know. I don't have any advice. I don't even have a request. I've heard from some high school seniors, and I understand, you know, 11 desks in a classroom would work for a high school setting, maybe even a middle school setting, but at the lower elementary schools, I don't know that that wouldn't be further harming their even idea of what school is. Thank you very much.
Thank you, Elisa. We appreciate your comment. Anything further? I think we've closed out public comment. Moving on. Does anyone have anything for Superintendent Howard? Superintendent Howard, do you have anything to address?
I don't. I mean, I think, you know, all of our folks who chimed in all had, you know, super important things to say. And I think it's important to hear from many. I don't believe in hearing just from a few. And I think that was well represented tonight. Our students, you know, just they're always impressive. You know, if anyone told me that I would be speaking to a large group of people at 15 years old, I probably would cry. It took me, you know, upwards of 30 years in the profession to be able to speak, you know, to a large group, whether it was through Zoom or in front of people. I'd be sweating and have a stomach ache. I believe our students are super impressive, and, you know, our parents care, our teachers, you know, certainly are speaking from the heart. And, you know, listening to Astrid Wiens tonight, I, you know, definitely learned a lot and have been, you know, schooled with the data in a way that it actually made, you know, really good sense to me. We want our kids back in school, and our kids are coming back to school. I would just encourage the school committee to really think about what you did here tonight, what impacted, you know, your thought process the most, and be mindful that we're making decisions about, you know, close to 1,900 students and close to 300 employees. So this is not just about an individual grade. We are learning every day. This virus is not did not come with directions or a playbook. Things are changing every day. I think we have been exercising our ability to be nimble and to move and block and redirect when we have to. And I think somebody, you know, threw out a term about, you know, changing the game tonight, or, you know, how things have changed. Things are changing every day, and we're moving and grooving with those changes, always with what's in the best interest of our students at hand. So there are lots of opinions. I think Mr. Perrin said it well. There are really no good answers to this. And if there is a good answer out there, you know, it would be nice for somebody to send it our way. Our teachers are essential employees. There is no doubt in my mind, although I haven't heard anybody at a much higher level than myself write that out or state that on anything public, but they are in the minds of our educational field. So we have decisions to make, and the school committee has heard a lot, and that was the key for me, was to make sure that when a decision is made, that it's made based on information, and it's an informed decision that is not taken lightly by anyone. So I could probably talk all night, but that probably is not a good idea. So I think I'm done.
Is there a motion to adjourn?
Yes, motion to adjourn.
I don't hear a second. Mr. Boncory?
I'm not seconding the motion, but are we going to talk about the motion that was made last meeting and the possibility of rescinding that now that we've met Board of Health, as Desi has suggested that the school committee listen to the Board of Health before they make any decisions? And now that we've heard them and we've gotten their vote, should we be revisiting our vote last meeting? And of course, I was not for the vote last time, so I can't make a motion to reconsider. But are we going to be doing that tonight?
Mr. Chairman,
Yes, Mr. Matucci.
the agenda clearly says public comment and then adjournment, so I'm motioning to adjourn.
Second.
We'll vote on adjournment. Ms. Galvin, take the roll, please, for the record.
Ms. Barry,
Yes.
Mr. Boncory,
Yes.
Mr. Capabianco,
Yes.
Mr. Martucci,
Yes.
Ms. Swope,
Yes.
Ms. Powell,
You're muted, Ms. Powell.
Yes.
Mr. Perrin.
No.
Good night, all.